Franklin Board of Health meeting order October 13th, 2025. And at this time, Wayne is excused and our alder person is not here. And Rebecca, I believe
Second meeting.
this is your second meeting, correct?
That is correct, yeah.
Are we missing anybody else?
Pardon me?
Are we missing anybody else?
We're,
Well, yeah, Dr. Relevich, that's right.
who is also excused.
Dr. Relevich is also missing. So we need approval of the minutes from August 11th.
Approve.
Any discussion? Hearing none, all in favor of approval, say aye.
Aye.
Okay, all opposed, nay. Then the approval of the minutes from August is complete. Any citizens for comment period? Okay, any unfinished business? Okay, then we'll move right into new business and administrative updates and our budget update.
Yes, the health department went forward to the finance committee meeting last month for our budget hearing. At that time, we were anticipating a steady budget and no changes. We had requested about $1,300 total for a couple different category items. One of which was not funded and two of which we anticipated increased funding in for the mayor's recommended budget. Then as of the week before last, we had found out via email correspondence that there is now a required 5% total operating budget reduction across the board for departments for Franklin. So we had about a week to make a decision about how we were going to do that. And it equated to exactly $42,890. So our total operating budget with non-personnel for our department in health is $68,000. So we were fully approaching it to try to maintain all staff and not cut any FTEs. With that came a lot of hard decisions and critical thinking because that left us with a really, really skinny budget if we cut $42,000 from our $68,000. So what we had sent back in our proposal last week, which was due by Friday, was to cut the $45,000 from our medical supply budget, $42,000. So that budget allows us to pay up front for vaccine that then we use for the flu clinics and other immunization clinics throughout the year. And the logic behind that was that that would most likely be the area that we could meet our goals through other avenues, hoping that partnership with a pharmacy or another medical provider could help us still support our clinics. There is like a small glimmer of hope that if funding works out and funds are found, that they could reallocate to the areas that we proposed in our cuts, which we would be hopeful for because then we could order immunizations for the 2026 flu season. So that's where we're at with that. We haven't received feedback on our proposal yet, and I don't know that we will, but it will go in the mayor's finalized recommended budgets in November.
Other communities, are they having difficulty with immunization?
Actually, Franklin hosts the most largely attended immunization clinic in the suburbs that I know of. And we've heard that time and time again. And unfortunately, we know it's also fortunately and unfortunately, we know it's an incredibly high valued service that we offer. But truly, at where we are right now, we would either be cutting staff that are able to perform core functions and statutory requirements, or the greatness of the health fair and flu clinic. So it was no-win scenario, but having the people to do the work we needed critically, and then hopefully through all of our partnerships and inroads we've already made, we could somehow work something out to have those clinics staffed. So that's where we are with the budget. And that's the only update I have as of right now.
Okay, and ordinance updates.
Yes, so the health department is pursuing some ordinance maintenance, so looking at the ordinances that we're involved in and looking to how to strengthen them and just continue to have longevity in them. And one of those is the ordinance in the municipal code 80-9B, and that pertains to vicious or barking dogs. So over the last few years, we've been having upticks in dog bites or dangerous dog declarations, vicious dog declarations, and we work closely with the with the police department on that. And essentially what it is one category has a dangerous dog declaration and one is a vicious dog. But the dangerous dog declaration required it to be on public property, and then vicious was private or public. But in practice, we were running into some complexities with that because the example we used at council was like a play date might be happening and the dog would bite someone that wasn't a part of the family on private property, and then that would make us have to jump to vicious instead of dangerous. So there wasn't really a solid application there because dangerous dog, you could have different parameters than vicious. Essentially vicious, they like have to move out or it can't be in Franklin anymore, or euthanization. But dangerous, it could be muzzled, have dangerous dog signs, be leashed when walking, and things like that. So the police department and health department took it to council this month on the 7th, and it passed, and it was really minimal. So just updating that language to add or private property to the dangerous dog declaration, and then also that a health officer or police officer could issue it. Before it only said health officer for some reason, while vicious said police or health. So just added some consistency in that.
We don't have any dog parks in Franklin, correct?
As of this moment, we
Okay.
do not.
I didn't think so.
Oh, is there?
It keeps like coming back and forth. Over the past few years, there's been a couple proposals on the board about it, but it hasn't come to fruition yet.
Got it.
And Delta 8,
All right, Delta 8. So as you will recall, we had a presentation at our last Board of Health meeting in regards to Delta 8, and the board had asked if staff could create a draft ordinance to bring forward. And we have Ellen Henry here with us today who will be presenting on it. But similarly, we have been in talks with the police department. Volition Franklin has provided education for us. And the health department has been critically looking at what we can do locally to protect our youth from Delta 8 products. And we're really proud of what we've come up with. So we've leaned into some other ordinances and had a meeting with the city attorney of how this might look here in Franklin. And Ellen will provide an update.
Hi, yes. So based on all the education we received, we were able to pull at least 3 different other either county or municipalities that have also adopted a Delta 8 ordinance, or I should say a hemp-derived cannabinoid ordinance. So it's fully encompassing of all of the synthetic marijuana type products that are not regulated currently because of the hemp bill. So we pulled, I believe, the city of Kaukauna, Wood County, and the city of Milwaukee's ordinance that was just passed. Based on conversations with the city attorney, he saw no issues with adopting the Wood County ordinance, which is, I apologize, I should have printed out an actual copy of the ordinance for you all. But it's rather simple, and it would be used to amend our current city ordinance, which I believe is 183-23, and we would add a subsection of there that would address Delta 8, Delta 10, and it would create age restrictions for the product. So it would be restricted to individuals 21 and older within this.
so it still could be sold.
Yep, it still could be sold. Retailers that are selling the product would have to verify age for the sale. So 21 and older. An additional piece within this ordinance is the adoption of a radius surrounding youth-serving organizations. So think of things like a hospital, local churches, schools, parks. The ordinance as written currently would adopt a 750-foot radius around youth-serving organizations, so that new retailers to the city would not be able to sell Delta 8 products or hemp-derived cannabinoids. Kind of with the intention of if a dispensary were to want to come and set up shop in Franklin, they wouldn't be able to be located right next to a daycare, kind of like that. But there is still plenty of retail space where that could be set up. And they would also be underneath that age restriction as well.
Apologies for this request in advance, and I'm happy to do it if you want to pass it down. But if the board is looking to possibly recommend this forward to Common Council, could you read that out loud?
Yes.
I realize it's like a lot of words.
Yes,
Sue?
I do
Before you do
have.
that, why not a complete ban? Why limit it, or have age?
That's a little bit difficult, just because it is not regulated at all federally or statewide either. It falls underneath the hemp bill. So these products, because they are synthetically made from the hemp plant, are legalized. So we can do an outright ban within the municipality. However, there is actually legislation that was introduced at the state level to regulate the product more heavily in the state. I think we all kind of know it tends to take several cycles before anything is ever passed at the state level, legislatively. I don't know if that's a word. So Franklin has the opportunity to pass a municipal ordinance in the very least.
Would you prefer we run some copies or read it out loud?
Just go ahead, read it.
Okay.
All right, bear with me.
If you want to popcorn halfway, I'm happy to take
Okay,
some.
so as written, it would be amending 183.23.2 and would be titled Hemp-Derived Cannabinoid Regulations. Subsection A. In this subsection, hemp-derived cannabinoid constitutes one of the many intoxicating cannabinoids found in the cannabis plant or a synthetic version thereof. Subsection within, a cannabinoid other than delta-9 tetrahydrocannabinol, or THC, or an isomer derived from such cannabinoid, including delta-8 THC, delta-10 THC, hexahydrocannabinol, HHC, HHCO, THCA, THCO, THCP, THCV, or hemp-derived products containing delta-9 tetrahydrocannabinol in concentration of 0.3% or less, does not include non-intoxicating cannabinoids, including cannabidiol CBD, which is an active ingredient in cannabis, but does not cause intoxication by itself, is not addictive, and does not contain other isomers as listed above. Any questions?
No.
Okay, subsection B. It shall be illegal for a person under the age of 21 to possess or use any amount of a hemp-derived cannabinoid, including delta-8 THC, delta-10 THC, HHC, HHCO, THCA, THCO, THCP, or THCV, except as specifically allowed by Wisconsin law. So if the Wisconsin law were to change, that would then change within our ordinance. Subsection C, it shall be illegal to sell or deliver any hemp-derived cannabinoid product containing delta-8 THC, delta-10 THC, HHC, HHCO, THCA, THCO, THCP, or THCV to a person under the age of 21 years, except as specifically allowed by Wisconsin law. Kind of goes along that. Subsection D, it shall be illegal to sell or deliver any hemp-derived cannabinoid product containing delta-8 THC, delta-10 THC, HHC, HHCO, THCA, THCO, THCP, or THCV to a person without having first verified their age by having the purchaser present a valid photo identification. Subsection E, hemp-derived cannabinoids shall not be sold within 750 feet of a hospital, church, or youth-serving organization, such as, but not limited to, child care centers, preschools, public or parochial schools, tribal schools, playgrounds, city or county parks, sporting arenas, or organizations with specific interests to serve children, including Boys and Girls Clubs, YMCAs, Head Start programs, etc. The distance shall be measured by the shortest route along a designated roadway or walking path from the main entrance entrance of the youth-serving business/organization to the premises selling hemp-derived cannabinoid products. The prohibition in this section does not apply to businesses selling hemp-derived cannabinoids from a location used for said sales on, and then it's a date, which would be the adoption date if council were to approve it. Subsection F would be penalty provisions that we would work on with the city police department.
Right.
Do we need a motion for
Thank
this?
you, Ellen. Yes, to
Okay.
recommend it forward or not recommend it forward
Okay.
to the common council.
Well, first I need an emotion
Motion to approve?
to approve bringing this ordinance to the common council. Okay, any discussion?
The last ordinance that we took forward, I think it was pending minor technical changes as applicable, if you
Okay.
wanted to work that in.
Okay.
I don't know if any will come up, but when we're doing our
Do you
final
think this
run
will
through
come
with
up
the city
before our
attorney.
next meeting?
Yes, hopefully.
Okay. So then, yeah, barring any major changes by the common council. So all in favor?
Aye.
Opposed? Okay, unanimous from the Board of Health.
Thank you for reading that.
I apologize
Helpful.
for the.
I appreciate it. It's nice to hear it on that.
You did fantastic.
Yeah.
You're not a chemist.
Organic chemistry.
Well done. All right.
Okay, then we'll go right into community health assessments.
All right.
Thank you, Ellen.
Unfortunately, you don't have a water with you, but this will also showcase Ellen again in a moment. But every 3 to 5 years, the City of Franklin Health Department does our community health assessment, which then yields our wonderful community health improvement plan. And that's what we have been working with the Franklin Health Collaborative on for the past several years. So we're really proud that that has at least 20 active individuals in it from different organizations across the city. And we're coming up on our next CHA cycle. So we are starting that, or intend to start that this fall/winter of 2025, collect some data via a community health assessment survey, and then roll it into key informant interviews and focus groups as well to get some well-rounded data that will then present again to a group at large to analyze the data and then set our next CHIP or community health improvement plan. But we have crafted the community health assessment. Did you print any? Or do you want to read them? No, I'm just kidding. It's many pages long.
Every line.
I
But
have
we,
at least 2 copies.
and I have this one. You can pass that if you want to. But we modified the community health assessment survey from our last cycle, as well as used the Milwaukee Healthcare partnership survey that the hospitals partner on and communities to formulate these questions. And we're hopeful that it'll yield some really wonderful data. So we intend to do a randomized sample again to hopefully meet a 95% confidence interval. 98 if we're ambitious, but 95 would be wonderful. And that would mean that randomized households within the city of Franklin would get this, and one individual within that household would fill it out. Then we would analyze all of the data, run some statistical analysis on it, and then have that information ready for the community group at large.
So similar to last time.
Exactly, yep. And we did meet our threshold last year, which was wonderful. I'll pass it on if you're done with it. If you could pass this around the corner to,
You got it already, so I looked at it.
oh, you got it? Okay. Perfect.
I looked at it, yeah.
Do you want to add something?
The versions you're seeing are the most up to date. There's a few like grammatical changes that need to be made, like forgot a D over here, or forgot to number this section. But like Lauren said, we're going to push for a randomized sample out of the community as opposed to a convenient sampling.
And again, when?
I'm sorry, what was that?
When?
Oh, the intention is to have the survey sent out in the beginning of November,
Okay.
with a timeline of hopefully having enough returned by the end of December. Right, so then in January, we start that review process of the surveys that were returned. And then from there, we can see what are areas where we might need to increase our data collection efforts. So we will be doing focus groups and key informant interviews again. And then the possibility of working with the Health Collaborative to do some smaller scale convenient sampling to get other data.
When do you expect it all tied up?
would expect the CHA to be, or the health assessment portion of the cycle to probably be wrapped up around May.
Okay.
And then June is typically when we would start to bring our partners back together to analyze all the data, and then by the end of 2025, have the CHIP finalized, or our improvement plan.
By our next meeting, you have,
We'll have very basic preliminary data pending how quickly we can scan them, because the deadline likely will be December 31st, and it'll probably be hundreds of surveys, but we plan to rapidly go through those as a staff as they come in. So hopefully by the second Monday of January, we'd have some baseline information to share.
At the very least, we should be able to at least draw some conclusions on the demographic data of the individuals that we survey.
so you don't need a motion for this at this time?
We do not. No, we just wanted to make sure to bring it forward and get your eyes on it,
Sure.
so that you were very much informed about it before it went out into the community.
Okay. Is there any problem having a request, having board members receive the survey?
Well, it is randomized, so we won't be able to do that. However, we will be able to do key informant interviews with you guys or
Okay.
participation in a focus group. So if you're interested, absolutely, I can send that out to the group.
Great.
Perfect.
Can I ask a weird question?
Yeah.
So as I'm poking through this, because this is kind of like aligned with my work, I'm not noticing anything related to like environmental risk factors, like proximity to gas lines or factories or things like that, that I know come up a lot of times in the stuff that we get from the city. So I'm just wondering if that is just not a component of this directly, or if you get that information more so from like their address or other demographics.
So we pulled a lot of our questions, really modeling it after the healthcare partnership survey, which didn't have a lot of like gas line type questions. But that's definitely, we have an entire, I was saying, the back page seems rather empty. So there is room to still include questions surrounding that if we do want to have a little bit more.
I do know that it's assessed
environmental.
pretty regularly in terms of like our water quality and our radon and things like that. So maybe that's information that you don't need, but.
We are able to find a lot of water quality and radon type testing through secondary data sources through Department of Health Services. But it would be good to have a pulse on kind of people's thoughts on that as well. I can definitely include.
Just out of curiosity. Okay. Everything else I'm looking for, I'm
What
finding.
sources would you use to get questions on that?
Well, there's some opinion questions, like I feel my health related to this is, and like questions about how you perceive things. So that could be an option. But like Ellen said, there are some data sources that we could use as secondary data. Like a lot of the individuals in Franklin are on city water, which those are measured for different levels of additives and whatnot, so we would right away know that. There's also private well samples that we would know if, I suppose, it went to the state lab, if they did a well test and sent it in, if there was an elevated level, and we do know specific business wells that test in a certain threshold. So there are ways to kind of pare that down. Radon, there is trend radon data that comes out of the Radon Center in Waukesha. So we would be able to know, and we do share some of those data points publicly right around this time of year. Actually, when people start to close up their houses, and we're encouraging radon testing to say like X% of the homes here have tested positive and whatnot. But I don't know what else we would do. We would have to take that back, but I did make a note of it for continued consideration.
Sure.
My nerdiness.
One other point of interest for the group, I'm not sure if we officially brought it to the Board of Health, but this summer our city applied for and was accepted to be included in the City Health Dashboard, which is run by, I believe, the NYU School of Public Health. So they compile CDC places level data that can break things down at the zip code and the census tract level, and it's specific for smaller cities, so cities under 50,000 people. So Franklin actually just got uploaded onto that board now, so it's another unique set of data that we can use to really help inform the CHA.
Sure.
Nice.
Any other questions, opinions? If not, we're going to leave administrative and go to clinical service updates.
All right. The breakdown of communicable disease for the quarter is on the back of your health department report, but nothing exceptionally noteworthy that differs from our typical that we're seeing. But I will provide, in terms of measles, the most recent update we have is as of September 30th, Wisconsin has 36 confirmed cases of measles. They do still, through DHS, keep that measles dashboard active, so you are able to see vaccinated status, unvaccinated status of the confirmed cases and any deaths that may occur. Nationally, the CDC has reported 1,544 confirmed cases of measles occurring in 42 jurisdictions as of September 30th, 92% of which are unvaccinated individuals or unknown vaccination status. About 12% of those had been hospitalized, and there were 3 deaths reported. So that's where we are with measles. Still encouraging individuals to be aware of their vaccination status, symptoms of measles, just be alert and aware. But I think that it's been hitting the news a lot, so hopefully people are in the know about what that can look like in a community.
And TB tests.
All right, TB skin tests, you have a little bit of a memo within your packet of information as well, but we are constantly looking for areas of improvement and increased efficiencies in addressing need here through the health department. And one of the conversations amongst our health department staff have been the current rate that we charge for TB skin tests. So over the past several years, there's just been continued increase in need of TB skin tests here at the health department, and we're looking to address that. So Caitlin, I will let you kind of explain this a little bit more, but this is in terms of cost here and what we will be charging.
Yeah, so like Lauren was mentioning, we have a current charge of $15 per skin test that we do here, and the rate's been unchanged for several years, but we're continuing to have a demand for it for school employment and healthcare requirements. So to improve access as well, we change our clinic hours from twice a month to weekly, and we're getting TB skin tests weekly now that we're getting requests for. And each vial of the Tubasol that we use costs about $115 and will provide 10 single doses. And the current $15 administration fee does not cover the full cost of supplies, staffing, and the administration. So for regional comparison, Franklin is one of the few Milwaukee County health departments that is still doing skin tests. And then pharmacies such as Walgreens and CVS are charging significantly more. And they also typically charge a fee to read, which we do not. So the Franklin Health Department wants to remain committed to meeting the growing demands for TB skin testing while still remaining affordable and accessible to clients. So we're looking to increase our skin test fee from $15 to $25 to offset the cost of the $115 cost per vial and potential loss since the vial goes unused after 30 days from being expired. Keep the services affordable and competitive, and continue to offer fees to waiver for clients that are unable to pay if they have financial hardship. So we're asking the Board of Health to approve a fee increase of $25 effective today, October 13th.
To $25, so from 15 to 25.
Yes,
So $10.
sorry.
That's okay.
And that will cover cover the supply and staffing costs, sustain this essential service to the community, and maintain equitability access through fee waivers.
Okay, I need a motion then to approve increase in fees for the TB test from $15 to $25. Okay, any discussion?
No, go
Well, I just wonder, how much do people charge? I mean, I know now what you're charging.
What are the pharmacies charging?
We did do a cost analysis or
Yes.
called around.
Yes, we called around to, so there's only 2 other health departments in Milwaukee County, and they're both charging $25 currently, and then CVS and Walgreens is charging anywhere between $50 to $75, and then an additional fee to have the test read as well.
right?
Yeah.
Okay.
It's wild. There's fewer and
You
fewer
sure you don't
employers
wanna
that
do
want it.
25?
I know.
So
It was a long.
is it
long
mainly
debate,
like
but yes.
students?
It's students, a lot for employment. Mhm.
Yeah.
If
So
you're
a
gonna
lot
work
that
at a
work in
hospital.
healthcare.
Well, we don't
Yeah.
do it in our hospital anymore.
Well, if you work, if you get a job
in
in
the TB Gold then.
I think the quantiferin.
But if you
that's very expensive.
It is. Yeah.
So this is a much more affordable for
Totally.
like a CNA or
Yeah.
someone.
Yeah.
Yeah.
Well, if you get a job in healthcare, let's say,
Mm-hmm.
don't the people you're getting the job from do your testing?
Or
If you,
pay for it.
It
let's,
depends.
yeah, it depends.
It
Let's say
depends.
you're a
Oh,
CNA at a
If
nursing
you're an
home
employee,
or
right?
something like
But
that. Yeah,
Sometimes you're,
that's not the
Yeah,
case.
but that's true, like a CNA at a nursing home.
yeah.
They wouldn't
They
have the
wouldn't cover that.
But a hospital, maybe you go straight to the hospital outpatient lab and they do
Right.
it. So it
Yeah.
just depends.
Okay,
Yeah, it just
Very
depends.
interesting.
I guess I'm surprised.
But is anybody opposed to the
No.
increase?
No,
No,
Is
that
anybody-
sounds right to me.
Yeah.
Anybody
your
think
money.
it should be higher? Okay, all in
I
favor?
would say since it's in alignment with the other
The health
public health
department.
departments.
Yeah, we're
yes.
trying to keep the cost down for people that can't afford
Yes.
it, yeah. So, all in favor of, this motion?
Aye.
Opposed? Okay.
Thank you.
Thank you.
Okay, flu clinics.
All right, we hosted our, well, now we've hosted several, but we hosted our first flu clinic of the season, which was our adult health and wellness fair, where we gave approximately, Dr. I have to say your name wrong, but Henry volunteered his time with us.
Sweet.
So he was able to do the check-in, and actually Yusuf popped in on the latter half of it, which I don't know if you were ships passing, but he did the screening for some of it, so Alderman Hassan. But we had about 250 people get their flu shot there. And then we have
great.
2 to 3 supplemental clinics after that we anticipate 70 to 80-ish individuals to come to. So it's really great. It's in high demand. The time that the newsletter or the mailing goes out, people are calling, and it's all hands on deck of staff scheduling those appointments. But it was really wonderful. We had more than a dozen vendors. Carol within our department has coordinated the vendor fair for many, many years, and it's gone wonderfully. So she did collect a feedback survey, and just from breezing through them, there's really high marks, which is great, but she'll be analyzing the data in the weeks to come.
Except for that person checking your insurance.
Yeah, right. They had a few things to say about
Yeah.
that.
Yeah.
No.
He kept asking to see their teeth. It was weird.
Yeah, right. So that was
How
great.
does it coordinate with the amount of vaccines you got?
Well, we have been keeping a very close eye on that over the past several years to make sure our order is very small margins. But it's really hard to tell because we have some walk-ins, and then we have these clinics that remain open for walk-ins for the remaining of the flu season. So hopefully we'll be fairly close to our ordering number. And then if not, you do get credit for return vaccine. So that's nice as well. So then our credit can roll over to the following
Following year.
flu season order.
Okay, good. Okay, we're gonna move right to health department programs.
All right. So some of the things that we have going on in community initiatives are also highlighted on your Franklin Health Department report. But as I mentioned, we had about 250 immunizations given at the Health and Wellness Fair, but people also come in to get the resources aimed towards older adults, even if they've already gotten their flu shot elsewhere. So we had about 300 participants come to that. We are spearheading a community cookbook, which is finally almost ready to launch. So we have gathered recipes from the community and different community organizations and compiled those as an effort for community connection and togetherness. And our administrative assistant, Allie, has put a lot of time into this and has formatted the entire thing, and we have officially received them in-house now. So we're looking to do some nutrition and community gathering push-outs, but we're still ironing out the details. So trying to do it like a actually targeted event. Anyone who had submitted one, we intend to give a cookbook to, but then from there, hopefully building more public awareness about the health department and nutrition in general through some resource tables.
How will they be distributed?
Hopefully at a resource table. So we'll host one. Usually we do a winter wellness or a healthy holidays theme where we do pop-up resource tables in accessible locations across the city or locations that we typically aren't in different aldermanic districts. And that will likely be the main distribution site.
And will you be charging for these?
No, there'll be no cost. We were
Will
able
there
to
be some
obtain a
in the
grant
health
for them.
department?
I don't know yet. We're gonna kind of see how it goes because we couldn't order like an astronomical amount of them, and it really depends how popular those education tables are that we host in the winter. But hopefully,
So if you have surplus, you could always just put it on.
oh, absolutely,
Yeah.
yeah. And then we're looking to also put it digitally so that people could
cool.
access it online.
That's
But
nice.
we wanted to make sure to have some hard copies because it's always nice to flip through.
Yes.
So we'll have that. Trunk or Treat is coming up. So Thursday, October 23rd, we're hosting our humongously popular Trunk or Treat event with the library. So we'll host it in the library parking lot again. We have many, many vendors signed up for it. I anticipate hundreds of kids again. It's always gone really well. We have a local police department that supports it and assists with it. So planning for another great year. Franklin Senior Membership Directory. So long ago when John Bignansky was the president of the organization before he passed away, was really passionate about trying to help the seniors know one another and modeling it after the Senior Walking Club. We were trying to do more or less like a membership directory or face recognition book for them, which is actually quite a challenging thing when you have an organization of over 100 people and we don't know the first and last name of everyone. So we've been just ironing out a lot of complexities with it, but we're assisting them with the project. And we went back again now for another attempt of taking everyone's pictures, and then we're going to kind of hand off the directory of photos that we format and let them, like their registration people, fill in the names and then help them publish it.
That's nice.
Just print it on just regular paper. But that's going well. We're going to go to the senior dining program at Root River in November to do an education, like speaking presentation on different topics. And hopefully at that point we can get the names. So that's in the works.
And nicknames too, I imagine.
Yes. Well, we started really ambitious and we were doing their names, how long they've been a member, and then a fun fact about them. But then that got really difficult. So now it's
Hard to do all
their
that.
names. And they can add as
Super
they
cool
wish.
how you're building community. I think that's fun.
Yes. Okay, and then stepping on. So this is a balance-centered class, a Milwaukee County evidence-based workshop that has been filled every single time we've tried to host it. So we're
Do
always
people take
trying.
it over and over? I'm sorry.
No, because the list is so long. So we have a huge
for
list,
them.
and people are always wanting to be involved in it. So 2 of our staff are hosting that workshop from October 21st through December 2nd, and it'll
Is
be
that at the
every
library?
Tuesday. What?
Is that at the library?
Oh, is it at the library?
It's here this year.
This in the hearing room? We'll be hosting in the hearing room.
Okay.
But we've kind of bounced around to
Yeah.
different places. It was in the library one time in the year, this last year.
Yeah.
So that's going on.
And where would that be publicized?
Well, it's already full. It actually
Oh, it
was
doesn't
already
matter.
full based on our wait list
Okay.
from the last one.
Okay.
So that's full. So we're looking to hopefully do another one like with a quick turnaround.
Okay.
Yeah.
Cool.
It's exciting, but yet also
Yeah.
you just don't have enough hours in the day.
No.
So hopefully we can continue to offer that. Some of the staff here today were at the Home Depot Kids Workshop. So went to Home Depot on Saturday, October 4th and shared some information about substance misuse prevention to the audience there and then performed car seat checks for those who were interested. Went to an MATC education table and hosted a blood pressure screening and Narcan training. So if you remember through the health department, we offer Narcan if you also then take the 30-second to a minute training, and that was really successful. And then we shifted our spring run that we had hosted in the past multiple years to work with the school district to host like a collective district health department run, which was at a county park last year, and then this year shifted to a glow run. So on Saturday, September 22nd, we assisted in hosting that, had some resources tables from Volition and the health department there, and it seemed like all the participants loved it. So
Will you do it
was
again next year?
adorable.
Oh,
I-
for sure.
Yeah, I feel like there's
Yeah,
no
the Franklin
going
Education
back.
Foundation really enjoyed it.
Yeah, so
That's good.
it's going well. We always use the event as sustainability for Volition Franklin. So we're hoping through that partnership it continues, especially since the grant is coming to an end. But it's been a good partnership in terms of being able to draw a lot of numbers and continue to get the word out about like, healthy related things.
It was a nice competition with the schools.
Cool.
Yeah.
Good. And then last but not least, Milwaukee County had approached Franklin and asked us if we would be willing to host their Free From Falls resource fair this year. So it was really low commitment from the health department, but just essentially being like a friendly face, have a welcoming room, and then help supply them like with some tables and sturdy chairs and things like that. And then they had residents from across the county come to our community room here at City Hall on Thursday, September 25th. So it was buzzing. We walked down there and it was very busy. We had someone come down and ask if we could go train them on Narcan. So that was like another outreach, which was fun. And then I saw some of the same faces at our adult health and wellness fair.
Okay.
So there was a lot of connection there,
Good.
which was good. And then there's a plethora of other things that I haven't mentioned that happened in quarter 3 of 2025 on the sheet that you guys can take a look at. And that is all.
Okay. Any questions so far? Comments? We'll move into presentation, education awards. Megan.
Yes, well, I am just introducing that she received this of Megan Conway, which now she is married and has a different name, but on her award is Megan Conway. But she was honored with the Beyond the Call to Action Outstanding Substance Use Professional Award from the Wisconsin Department of Health Services. So throughout the state of Wisconsin, Megan obtained that. So she was honored at the conference last month, and we're incredibly proud to have her on our staff and doing great things in the Franklin community. So congratulations again,
Can you
Megan.
kind of explain why you got the award?
Yeah.
Yeah.
I'm just the vet. No, I'm just kidding.
Really, it was recognition from partners and from the health department, and that put in the recognition for me, just for the work that I'm doing through Volition Franklin. But it feels more like a kind of a community and department award, because I have great mentors that have also been in my position in Volition that have kind of taught me the way. So it feels like a shared award just for all the amazing work in substance use prevention.
What's going on with Volition right now?
Well, we're moving on. I mean, we're moving into our last year of DSC funding. So year 10, we have been working on several different things. One of them being the presentation at last meeting for Board of Health to talk about Delta 8. And then I think we're just kind of moving forward with strategic planning, our action plans for moving into year 10 and kind of what's going to come beyond. So whether that be looking for additional funding to sustain, there's also opioid settlement funds I think that will help continue to work in prevention and harm reduction going forward. So
Can you talk a little bit about the BAR toolkits?
oh yeah, so I think back in March or maybe before that, we received a grant to disseminate toolkits to bars, essentially providing them with information on how to check an ID, ride sharing opportunities that bars are already involved in, but just pushing that information out to their patrons that, hey, if you've had too much to drink, you can ask your bartender to get you to ride home. You could take a Uber or a Lyft. Because we did some research and realized that there were a lot of DUIs happening within our city limits, especially among the older population, like 65 plus, that were drinking and then driving home. So we wanted to try and get some community education out there just to kind of let people know, hey, there's other options for you. So we just ordered the toolkit from Digicopy and got that received, I think, last week. So we're going to be putting toolkits together, and then I'll be delivering them to the bars in the area, kind of making that connection, letting them know that if they need resources that we're there as an option. And then I think along with that, it's a good touch point to let those businesses and organizations know that we offer other services like Narcan trainings for their staff as well.
Is that just the taverns or restaurants that have bars also?
I believe both.
Okay.
But I think my starting point is going to be with the bars, and then kind of grow from there, just to be able to make those handshake interactions with people.
All right.
Any questions for Megan? Thank you, Megan. Congratulations.
Thank you.
Okay. And next would be Health Department, 25 WASD business owners.
Yes. So recently we were reached out to from the school district to recognize us as Wisconsin, some school district, I don't know what WASB stands for right off the top of my head, but Wisconsin Association of School Boards.
Okay.
Makes sense.
So them and Franklin Public School District, we're recognizing City of Franklin Health Department as being a partner who has positively partnered with them for hosting of student interns. So we've had a couple high school students work with us, and through Volition Franklin and other avenues in the health department have been exposed to the world of public health, which we're really proud of because we want to do anything we can to support the public health workforce and then also help foster this community connectivity for these students. So actually at the October 7th Common Council meeting, we just recently also had an updated contract signed for this next school year in case any other students will be interning with us.
Nice.
So,
What about college?
well, we have a lot. Yeah, we do have a lot of interns from like all different avenues, and it's almost overwhelming, but it's also hard to say no. So we just make sure that we have a really well structured work plan. But we have the AHEC partnership. So through AHEC, we host community health or CHIP interns. We've also had nursing master students reach out, bachelor level students, bachelor's of public health students from UW La Crosse, master student from Nevada. A bunch of different things happening and in the works. So we're excited.
Those are required by them?
Yep, and then we just recently had a meeting with the University of Milwaukee's nursing program because they're looking to do that. But that's a little bit more of an unconventional format in that their nursing students come for their clinical rounds. And it's like a plethora of like 8 to 9 students who come like on one day, or no, every day.
One day.
Wait, what is
for
that?
9 weeks.
Yeah, one day of the week for 9 weeks.
Are you doing a lot of community visits with them though? I don't know if that would be a lot of
Yeah, I'm trying to,
Time well
think that
spent.
too.
thinking about my
So-
own community
From a
rotation in nursing
clinical-
school. Yeah.
So yes, this is what the robust meeting was about. We're exploring it for fall of 2026, and we would plan the days. Well, they kind of had like a low. We didn't have to commit a lot of things, but we felt like we'd give them the best experience if we already planned that in advance, which is why we chose fall to do like out in the community, like blood pressure
nice.
screenings,
Oh, sure.
community presentations, our CHIP meeting, because it'll be going along with a community health assessment, community health improvement
Fantastic.
part of their education. So we couldn't commit to spring because, again, we wanted to have that work plan well laid before they came on site. But we thought, okay, we can do this if we have some foresight into it to give them a great experience with some guest speakers, Narcan trainings, things like that.
Fantastic.
Nice.
Great partnership.
Yeah.
And the fall we have our flu clinics. So
I was gonna say. Yeah.
that wouldn't hurt. So
Fantastic.
yes, so that is going well too. But we were honored at the school board meeting last week, so I wanted to put that on there. Thank you.
And we'll finish up with environmental health updates.
All right. Well, we completed our self-assessment for the DATCAP program that was due at the end of last month, which is essentially like pulling all the numbers from your program throughout the year, and that has been submitted. Mobile inspections are still like skyrocketing. So we did more than 70 food vendors at various events over the summer. So in Q3, we were very busy with that. And just it doesn't end. It's very, very busy. The winter used to be our slow season for food trucks, and now just due to increased popularity of food trucks and like a lot of different events becoming familiar with food trucks, they're just always here. So we're not slowing down in the world of food trucks.
Primarily at the Rock.
All over, truly all over.
I haven't seen them elsewhere. Where else?
Well, a lot of like St. Martin's Fair, Civic Celebration,
Okay, I got it.
Croatia Park,
Right.
beer gardens.
The sports complex does
Colonial.
like
Yeah,
a little.
The craft thing.
Craft
Franklin
fair,
Public
thank you,
Schools,
Craft
the
Umbrella.
PTA has been hosting a lot of events.
Okay.
So looking at that, and then,
stay away from?
well, on the record.
Can you recommend?
And then we will be doing our analysis of ordinance and fee scheduling with that in spring. So looking at that. And with the federal crunch of funding and our local crunch of funding, we're just trying to do what we can. But we do have that 0.1 FTE of our sanitarian a tax levy that we've increased like for historically for a few years now to 0.4. But without that being sustained at the city level and without receiving grants as readily, we're just hoping to do anything we can for that because the program is bringing in revenue and we also need to support the food and safety situation out in the
100%.
community. So we'll see, but more to come on that. Those are the main environmental health updates I have.
So, any other topics to bring up? Hearing none, I need a motion to adjourn.
Oh,
Oh,
I do
never
have
mind.
one. Sorry, I do have
Cancel
one.
that last statement.
I thought we could set our meeting dates
Oh,
for
yeah, yeah.
2026.
Good.
So to remind us all, maybe 2 years ago, we voted to primarily do
Quarterly.
the 4, yep, so
And
quarterly.
preferably the beginning of the quarter, in case we have to cancel it, we then have
Yes.
time to add another one.
So remind me, we like to do January, April, August,
Yes,
and then October. Okay. So it would be, apologies for not getting this in advance, but I wanted to make sure. So that would be, let's see, am I in the right year here? 2026, Monday, January 12th. Monday, April 13th. Monday, August 10th. And then Monday, October 12th. And then any meetings as needed,
What was
And-
the April date? Sorry.
April 13th. And then if we don't have quorum at any of those, we would then need to add an additional one.
right. But
To
we would
ensure that
have
we
2
meet four
months
times.
to
So
add.
that was January 12th, April 13th, August 10th, and October 12th.
Yes,
Okay.
that is
Thank
correct.
Basically the second Monday of
Yeah.
January, April, August, and October.
Yes. And if those are the dates that we're all in agreement with, I will send them out as well so that the rest of the committee can know.
Yes.
Works for me.
Perfect. That has worked really well, so thank you for that proposal of an idea. I think that having them in our set calendar
Yeah.
helps us instead of
Trying to
overtaxing
fill it in
everyone's
that
time.
later, yeah.
Okay, now I think that's all I
Okay.
have.
Now I need a motion to adjourn.
So moved.
Second?
Second.
Okay, all in favor? Aye.
All right.